Hello, I'm Mark Chigani, and this is Straight Talk. With me today is Dr. Aracina Ma. Now, Dr. Ma, you are the president of the Hong Kong Public Doctors Association. Now, when you say public doctors, you mean obviously government doctors, right? Department of Health doctors and so on. And you yourself work in a hospital,
yes,
right? In a government hospital. I'm going to ask you a personal question. You know, when you go to a government hospital, you've got coronavirus patients there, you go home to your family. When you go into the hospital, do you get emotional seeing all these sick people in there coming down with this virus?
Actually, I have been a doctor in the medical field for 17 years, and actually I'm graduate in the SARS year. And my classmate, my teachers got SARS and things. Things go through, for me, it's not that emotional, but of course, some cases do touch me, but I'm not that emotional.
Doctors cannot be emotional, right?
Yes, but how to say, but sometimes because of the policy or because of the actual environment, sometimes we get crossed, but can't be too emotional because things just come up very fast. You need to react very fast, and especially in the hospital I'm working in, is one of the hospital most overcrowded in Hong Kong. So we get used to be put down our emotion, go straight in and work. And
deal with it. Yeah. And then you go home. Do you worry that when you go home, you could infect your family?
Yes, sometimes. So when I was working in the dirty team, that 4 weeks, same as other colleague, I choose to move out and live in one of those hotels for 4 weeks during
So when you were dealing with the coronavirus cases, you moved out of your home and stayed in a hotel?
Yes.
For 4 weeks?
Yes.
Did you miss your family?
Actually, I do mix a short visit occasionally, but during that 4 weeks, I never eat with my son. I just put on mask all the times, even I was at home. I just try to have very close contact with him. But as far as we know, we don't have colleagues getting sick after taking care of the patients. It seems that the infection control, what we are performing right now in the hospital, is work quite well. So our situation is a bit different from what happened in other countries. Many healthcare workers get really sick and so on.
That didn't really happen in Hong Kong, right?
Not really. I guess because my friend in the States said that they really run out of respirator masks, surgical masks, facial and so on. They need to reuse it even for weeks or so. Actually, from our experience during the SARS period, putting on a dirty mask again and again is the highest chance for you to get infected. But we are not doing this in Hong Kong.
How safe is it for people to go to hospitals now? I mean, you've got daily infection cases of over 100 for the past few days. How safe is it for people to actually go inside a hospital now?
It depends on the purpose or which part of the hospital you go. In the emergency room, yes, there is chance because many different patients sitting on the waiting area. We just don't know what that patient is. Although patients go through the triage area and the nurse will take some simple history. But you know that sometimes patients cannot give the history straight away. So in the emergency room, yes, there is risk. But we try our best to low down the risk. But in the let's say the specialist outpatient department, we try to cut down the number of patients attend the clinic. We also screen the address. If those patients are living in those highly infected area, we'll phone them up first and ask them not to come. We just refill you some medication. And also we'll test the temperature for everyone goes into the clinic. Make sure they're not having fever. And also, I'm not sure whether you have visited any one of the public hospital nowadays. When you go through the lobby, there will be a big a thermometer, just like what inside the airport. Everyone will
thankfully, I haven't been to the hospital for a
yes,
while.
but everyone need to check the temperature before they go into go through the lobby. So we try our best to cut down the risk.
Are the hospitals now? You know, you said that the one you work in is one of the most overcrowded hospitals. Are they reaching breaking point? Because as I said, you've got 100 plus cases every day for the past few days. You know, are the government hospitals now reaching a breaking point?
I don't like the terms of breaking points, but we do have several very pressurized or stressful area. First of all, the situation of isolation bed or isolation rooms are really tough. We have many new cases every day, but you know that the maximum number of isolation bed we can have is 1,700. So definitely we may not able to put everyone who got test positive into the isolation area. So that's why the government opening up the community isolation facilities in Lei Yue Mun or in the Asia Expo. I think that is the very right decision. Actually, when the union talked to the hospital authority management, we have first raised this idea in sometimes called late February or March. But it's lucky that the episode at that time gone down quickly. So we just have to brainstorm the idea, but we never put it on the way. But this time we need it.
Well,
and I hope, yes, I hope they can carry it on faster.
Well, this time it seems a lot more serious. Let's have a look at a bite over there.
We are seeing patients who have many social activities. If this trend continues, it is very difficult for us to handle the situation because only relying on quarantine or isolation of cases would not work.
Now, Dr. Chuan Shuk Kwan, she's from the Center for Health Protection. You know, she's been giving daily press conferences now, and she's virtually is now saying that the situation is out of control in Hong Kong, that they just don't know where these cases are coming from. You know, every day when you've got new cases, half of them are traceable, the other half are not, right? So how much longer can hospitals cope with this? You say you don't want to use the word breaking point, but how long can hospitals cope with this? And why is this happening?
I think if we don't change our strategy, yes, we are not able to cope with it. But if we change the strategy, let's say decide who should stay in the hospital, who should stay in the isolation facilities, who should even stay at home. And actually, if we can make it clear, maybe the situation is not as bad as what we think. Why I say so? Because compared to the pictures in Hong Kong with the other Western countries, I know that in other Western countries, they have many cases are really ill. Even the young adult, they're really ill. They need the mechanical ventilation. They go to the intensive care unit. But in Hong Kong, our mortality is still quite low. Now we still can able to maintain 0.1 to 0.2%. Although we see more.
You mean 0.1 to 0.10% mortality rate compared to the infection rate?
Yes, yes.
Okay.
So
is that considered low?
Yes, it's quite low. Yes, and actually, as I remember, in the States or in the United Kingdom, it reached to 0.5 something. So we are still lower than the Western country. Although we see more and more ill cases, but most of them, they're elderly, because we have outbreak in the elderly home. Some of them are the elderly community elderly that with long-term chronic illnesses. So for those young, healthy adults, even they got infected, they are not that bad. They just get a very short period of flu-like symptoms, and then a week or 2 weeks, they are not infected, they're not contagious, they can go back to the community.
What do you think happened, Dr. Ma? I mean, we had for about a month or so no new cases. Everybody thought everything was okay, the bars reopened, and then all of a sudden, you've got this outbreak. What went wrong?
First of all, as the expert said, that the Hong Kong study said that the index cases of this wave are not coming from this community. They are imported from somewhere outside. And the other experts said that those who imported the index cases are those exempted from quarantine or exempted from viral tests, likely the sailor or the airplanes, the flight crew, and so on. So once they are infected, They go into our community, they take taxi, they go to a hotel, they shop, they eat, and then that's why the virus start to go into our community again.
Was that a mistake? Should they have been in quarantine?
Personally, I think they all should be quarantined and should be tested. If you don't want to put them in 14 days quarantine, maybe too long for them, you should test them straight away, like other citizens who return to Hong Kong at the airport. Take them straight away, wait for the test result. If it's negative, they can travel in Hong Kong. If it is positive, they should be sent to the isolation facilities. Actually, I think the exemption policy is maybe the reason for this outbreak.
So the new outbreak is because the government exempted visiting sailors and flight crew, and they could just go to bars and restaurants, and you think that's how it all started?
I guess this is the starting point. That's also the guess of other experts.
So now can we break that chain?
I think it's a bit difficult because I guess that there are widespread of infection in our community. Many of those infected ones, actually, they are quite silent. And then you can get the infection from different parts of the community, in the restaurant or even in the wet market.
Sure. After a quick break. See you soon. Don't go away. Thanks for staying with us. This is Straight Talk. With me today is Dr. Aracena Ma. You're the president of the Hong Kong Public Doctors Association. Before the break, I was asking you, can we break this chain? Because as I said earlier, half of the people that are being infected more or less on a daily basis are untraceable. You're saying we cannot break this chain? Is it going to get worse?
Whether you can break, actually, before we said whether we can break this chain, we may ask, can we trace all the chain? And as what Zheng Zhuguan said, that it's getting more and more difficult for the contact tracing. There are more and more patients with unidentifiable source.
So how do we stop it?
The most important way to stopping it is stay home. Just try your best to cut most of the activities outside your home.
Do you stay home aside from going to work at the hospital?
To be honest, I stay home most of the time. Besides going out for work, I do most of my shopping online, the takeaway, and so maybe I go out to the open area near my home, just over the weekend or Sunday with my family, but I seldom travel to the big shopping malls, or maybe just do a quick shopping and then go home.
Now, I asked Professor Ben Cowling from Hong Kong U last week on this show, and I'll ask you the same thing. You say avoid going out, don't go to the big shopping malls. If you have to go shopping, do it very quickly and then go home. Do online shopping if possible. But people need to go out and get some fresh air. Now, what Professor Cowling said was, if you're out by the waterfront walking in the fresh air, if you have a face mask on, then the spread is not that likely because you're out there in the open.
Yes.
Would you agree with that?
Yes, actually, the outdoor environment, the airflow and so on, is a very effective ventilation. The big shopping mall, the air-conditioned area, it is not effective air ventilation. We said that the office of the big shopping mall, the air exchange each hour is only 1 to 2. But what is enough for avoid getting infection like this kind of disease should be 6 or 5 or so on. So if you always stay inside the indoor air-conditioned area, it's got higher risk to get infected with this kind of infectious disease.
So it's better to be outdoors walking than to be in a shopping mall eating in a restaurant or going to the supermarket.
But personally, I do advise people to wear your mask because last week when I go to in my community, the seafront walkway, many people are jogging without their mask on. Actually, it's quite crowded. So I think if it is possible, try to put on your mask because maybe someone just walk past you and have a big cough or sneeze, you still got the chance to get infected.
Dr. Tan, one thing that a lot of people wonder about is you go to the supermarket, and you pick up something like a box of cereal or a carton of milk, and then you don't like it, you put it back on. Other people have obviously touched it as well.
Yes.
Now, when you finally choose the things that you want to buy and you bring it home, what do you do with it? Do you sanitize it all, or do you put it into the refrigerator, or do you put it outdoors for a day until, because perishable goods like frozen foods, you have to put into the freezer, right? What do you do?
Actually, you're right. And for the coronavirus, experiment tells us they can live on the environment in the room temperature or in the fridge for a few days. So yes, of course, for everything you bought home, you should just clean it before you put it into the cupboard.
How can you clean something like fresh vegetables?
Yes, it's difficult. So I think the most important thing is that when you touch your nose, your eyes, and your mouth, always wash your hand before you touch it. Maybe you do some, you touch the food, everything, but don't touch your face. Always clean your hands before you touch your face. So hand cleaning is also a very important procedure.
Well, now, Carrie Lam, the chief executive, said on her social media that people were fear-mongering by saying that the government was planning an imminent total lockdown. She said there are other things that could be done before a lockdown. As a doctor who goes to hospital and treats coronavirus patients, do you favor a lockdown at this time?
I would like to say, actually, I agree, some things we can still work on before the lockdown. For example, try to cut down the number of people going into Hong Kong with the exemption. As what we know, there are still many sailors go in with the exemption. Although now they are all advised to take the test before they get into Hong Kong. But when they are waiting for the test result, they're still allowed to go.
But what about shutting restaurants? I mean, why not just shut the restaurants down completely?
First of all, people are still working. Not everyone can work at home. So if someone still go out and work, they need somewhere for their lunch. And secondly, I think the restaurant can have some changes about how to place their table, how to place their seats. So just make sure that everyone is eating facing the wall rather than facing each other. So there are still some other measures we can take before we shut down everything.
But do you think that shutting down everything can actually break the chain if you shut the whole of Hong Kong down for 2 weeks?
Theoretically, yes, but maybe we are not willing to do so.
But practically,
yes.
You cannot do that, right? We're a small city with 7 million people.
I think if you really want to do it, you need a lot of preparation, and also the whole city need to be determined for this.
Well, they did it in Wuhan.
This is a government policy. I'm not sure whether the people there are willing.
It's going to be very difficult for Hong Kong. I know. Now, I remember when the virus first started earlier in the year, you, among others, said that the hospitals didn't have enough face masks and other medical protective equipment. You have all that now, right?
Actually, the condition improved because, how to say, besides the purchasing policy, personally, I sympathize the management of hospital authority because in March is a very difficult time. Many countries just shut down, don't let those respirator masks, protective garment to export it. So the hospital authority have tried their best to find the new sources.
But now you have enough.
Yes, they have some locally produced respirator masks and so on.
Now, the other worry, other doctors have warned about that, including doctors in the U.S. and elsewhere, saying that whatever you do, now people at first thought that the virus would go away in the summer. It didn't.
No.
Okay, so now they're saying that it will come back in the autumn, in the fall. It'll come back to
anytime
to Hong Kong. But that's also the time when you have the flu. It's also the flu season. Now, you know, you work in the public hospital. Are you worried that we will have a double whammy? You will have the coronavirus hitting us back again, combined with the flu? Can you cope?
Actually, when we look at the data in February, February is one of the peak season for flu outbreak. But actually this year, the flu outbreak is so quiet because everyone is
wearing a mask. Right.
Same as now, as July and August is also another summer peak flu season, and we haven't saw any flu outbreak yet. So if we keep on doing the mask wearing strategy well, maybe we will see the flu outbreak become smaller and smaller.
Are there enough government doctors in government hospitals? Are you short-staffed?
Actually, we can say, when you look at the general condition, in hospital authority, we are quite always short of, let's say, 5 to 10% staff. But however, the condition, because we have cut many elective activities, elective surgery, elective clinics right now, so we can free some staff from, let's say, the surgical, orthopedics, or other departments. And actually, the hospital authority try to coordinate with them. They can also come to the medical team, try to help us for the COVID crisis. So some of the surgeons are sent to the Li Yunmun Hospital. There may be some will go to the emergency room, or some will go to the Asia Expo. So we mobilize our staff, and also some private doctors in the private sector are willing to help. So I think for the hospital staff, we got enough staff at this moment.
Just last question is another personal question. You talked about private doctors. You're a public doctor, you're a government doctor. Private doctors make a lot more money than doctors in the government.
Not necessary.
Why do you choose to be in the government?
First of all, I think nowadays the difference between salaries between public and private doctors are getting narrower. Yes. And secondly, I think I'm a geriatrician. So if you really want to serve a large amount of elderly patients, especially those elderly patients in a disadvantaged environment.
You treat elderly people?
Yes. I work, actually in Hong Kong, all internal physicians, we treat everyone, but I'm specialized in the elderly people.
So why do you choose to be in the government?
Because this is the place where you can serve as many as you like. There are many elderly in Hong Kong that are in a really disadvantaged condition, living in the elderly home, just like what we see, so many elderly home get outbreak. The environment there is really bad. The staff there are not really professional. They are undertrained. Some of them are...
In the elderly homes, the staff are not trained properly.
Most of the staff inside the working in the private elderly home, they are not nurses. What we call them are healthcare workers. Actually, they just receive, let's say, 20 hours of training from the social welfare department. And also, they got many, let's say, assistants from the mainland. They are even less well-trained. So there's the infection control, the clinical sense are not very good. And also the elderly home, especially the private elderly home, they're really crowded. Everyone just get less, just like every elderly just get a bed and a cupboard.
Sounds terrible.
Yes.
I've got to end the show. See you next time. Good evening.